Let's talk about the screening process for your child to evaluate whether they're a good fit for Toothpillow. It's easier than you might think. First, let's do a self-assessment. Start out by taking a look at their baby teeth. Are there gaps between them? Ideally, you should see about 2 to 3 millimeters of space, enough to fit a nickel between each tooth. This spacing is crucial because adult teeth are bigger and there's more of them and will need room for them to grow in properly. If the space is less than that, it might be a good indicator that there is some potential growth opportunities for your child. Next, we can check their bite. Are the teeth aligning correctly? Do you notice a cross bite where the upper teeth sit inside the lower teeth? Also observe the shape of their dental arches. Is it broad and wide, or is it more of a V shape? What about their facial development? Does your child have a long, narrow face or dark circles under their eyes? Now let's think about some of their oral habits. Are they thumb sucking, using a pacifier, or breathing through their mouth? Are they perhaps a picky eater? Picky eaters, believe it or not, with less than 20 foods on their list, can be an indicator of an airway issue. If you notice them tilting their head forward frequently, or maybe chewing with their mouth open or struggling to get air while they're eating, that might be an indication of an airway issue. Clenching and grinding their teeth, or loud breathing while sleeping, or snoring for sure while sleeping are also things to be concerned about. If any of these signs sound familiar, we do recommend getting your child evaluated by a dentist trained in identifying growth issues. The American Dental Association has recommended that all dentists screen for suboptimal growth and development and refer those patients to a specialist when necessary. At Toothpillow, we've simplified that process with an online virtual form, and we'll also ask for some photos of your child. Once you press submit, your form comes to us and your child's case will first be reviewed by our clinical advisory board. They will determine if your child is appropriate for virtual care or if in-person evaluation is needed. If virtual care is an option, then your child's case will be assigned to a dentist in your state. These dentists specialize in airway development treatments and will conduct a more thorough evaluation that will result in a diagnosis. Most often, their assessment might involve big words like malocclusion or suboptimal craniofacial growth. Now, these are just fancy words for talking about misaligned teeth and small upper or lower jaws. When we intervene on these diagnoses early, they are treatable. Delaying can lead to a more complex treatment down the line. By correcting habits and guiding proper growth early, our children can sometimes even avoid the need for braces down the road. So what is Toothpillow's goal? To correct poor oral dysfunction by training your child's tongue to rest in the roof of the mouth where it belongs, helping the lips stay sealed and ensure nasal breathing. This naturally widens the upper palate and stimulates proper jaw development, in turn helping your child breathe better. So let's take the first step together and begin with a free screening.